Becoming a parent is one of the most beautiful experiences in life, but it's very natural to have questions and even concerns, especially if you're considering pregnancy after the age of 35. Navigating pregnancy after age 35 comes with some unique challenges, but also some incredible rewards. In this video, I'm going to be sharing some essential tips as well as some expert advice to help you embrace this beautiful journey with all the confidence and peace of mind that you need in pregnancy. I'm Dr. Pinnock, and I'm a board-certified OBGYN and high-risk pregnancy doctor, and I'm passionate about helping you to have a healthy and enjoyable pregnancy. So if you like my videos, don't forget to subscribe to my channel. Now, let's jump into this topic. First, let's understand what we mean by advanced maternal age. This term typically refers to women who are 35 years or older at the time of pregnancy, or if your due date during pregnancy happens after you turn 35. As we age, there are certain factors that can change, that can affect our overall fertility as women, as well as our outcomes as women. Interestingly, more and more women in the US are having pregnancies for the first time later in life. Actually, up to 9% of first-time births are to women over the age of 35. So if you're having a baby for the first time and you're over 35, you're in good company. Now, the reasons for having children later in life are variable. Some people opt to explore having children after they've achieved a certain level of stability in their careers, while other people may have partnered later in life or gotten married later in life and perhaps weren't thinking about having children, but now it's something that they're interested in exploring. And for other people, perhaps they had some personal goals that they wanted to accomplish before having children. You know, the reasons vary, but what we are seeing is that more and more women are having children later in life. And when we think about 35 as that cutoff for advanced maternal age, we actually chose 35 as like a medical community because when we performed a procedure called an amniocentesis, which is when we sample that amniotic fluid around the baby, and this was oftentimes done to do genetic testing for baby. But essentially, when we performed that procedure, the chance of having a complication from that procedure and the chance of having a baby affected by Down syndrome was equal to each other at the age of 35. And so shockingly, that's how we came up with 35 as advanced maternal age. So you may be thinking, that's really strange. And it is a little bit. So overall, nothing specifically special happens at age 35. But we've since then done a lot of studies, both looking back at women who've delivered babies above the age of 35, as well as studies that followed women who got pregnant over the age of 35 and followed them during the pregnancy just to see how things unfold. And we found 3 things about women who got pregnant over the age of 35 that I'd like you to keep in mind. The first and most important, I think, is that most women who have their first baby after age 35 have good pregnancy outcomes. They're able to cope from the physical and emotional stresses of pregnancies as well as parenting just fine. So phew, you can breathe a sigh of relief. That's good news. The second thing that we found is that there are some changes that start to happen in your body as you age, and that can affect some pregnancy outcomes. And as a result of these changes, the risk to your pregnancy due to your age actually start to happen after age 35, but they happen over a spectrum. So those who are between 35 to 39 perhaps have a similar risk in terms of that spectrum, versus those 40 to 44 have a different risk, and 45 to 49 have a different risk, and then women over 50 who have children have a different level of risk. And so these risks to your pregnancy sort of slowly increase over these age brackets. And so someone at age 45 would theoretically be at a higher risk of experiencing some of the things that I'll talk about in a minute than someone who is age 35. You know, while many women have healthy pregnancies after age 35, I think it's important to just be aware, at least peripherally, of some of the increased potential risks of your pregnancy due to your age. And so I like to really think about these considerations in 2 buckets. The first are early pregnancy risks, so things that can potentially happen before pregnancy and in the first and second trimesters. And then the second would be sort of the late pregnancy pregnancy risks. So that would be things that could potentially happen in the third trimester or around the time of delivery. And so when we think about early pregnancy risks, one of the first challenges that I'll talk about are fertility changes. Many women already know this sort of anecdotally, but your fertility naturally declines as you age. Due to this, there are less eggs available over time, and the quality of the eggs that you have over time also go down. And so because of this, it can make it a little bit more challenging to get pregnant as you get older. And technically, your fertility starts to decline after age 32. And then once you pass 35, the decline in your fertility actually goes down even faster. The reason for this is women are actually born with all of the eggs that you'll have for your entire lifetime to use to conceive with or to make a baby with. And every month during your menstrual cycle, there are less and less eggs available to make a pregnancy. And so by the time you get to age 35, we do see that the amount of eggs available for you to get pregnant with go down. And then by the time you get to age 40 and 45, those numbers actually start going down at an even faster rate. And so that is sort of the background as to why fertility sort of goes down over time for women as they age. The next early pregnancy risk that I'll talk about is increased risk of having a miscarriage or pregnancy loss. And so this is obviously something that is really challenging if it does happen, but we have seen that the miscarriage rates are also higher in women over 35. And the reason for this can vary, but oftentimes it's due to sort of a chromosomal issue or a genetic issue with the pregnancy. So after the egg and sperm combine, sometimes there's sort of misalignment in that combination that can lead to genetic problems with that pregnancy that can lead to early miscarriages in the early parts of pregnancy. As sort of an extension of that, we also see that there is a higher risk of having genetic conditions as you age in the pregnancy. Conditions like Down syndrome are more likely to happen for women who are above the age of 35, which is why, we recommend at least some basic genetic testing in the pregnancy to pick up if your pregnancy is at a higher risk of experiencing a genetic syndrome like Down syndrome. With all of those things being said, I've taken care of many, many women who are above the age of 35 in pregnancy who had no trouble getting pregnant, so no problems with their fertility, no problems with the miscarriage, and also no problems with their pregnancy being affected by a genetic condition. So I just say that to say, although these things have higher probability or higher chance of happening because of your age being over 35, it does not necessarily mean any of those things will happen to you. Let's turn to some late pregnancy complications. Again, as I mentioned before, nothing magically happens at age 35, but we do see a higher risk of certain late pregnancy conditions that I did want to mention. And one of them is a higher chance of developing something called gestational diabetes. Now, gestational diabetes is a condition that is unique to pregnancy. Essentially, it's a condition where your body doesn't process sugar or glucose in the way that it usually does when you're not pregnant. And so this can cause you to have some high blood sugar values that can affect the pregnancy. And so, we do see this occurring at a higher rate in women who get pregnant above age 35. And so that's just something to keep in mind as a possibility. Another condition that we see occurring at a higher rate for women who get pregnant at an older age is high blood pressures in pregnancy, or something called preeclampsia. So preeclampsia is actually a condition that is unique to pregnancy. Essentially, it's a combination of a number of things that can happen, but primarily we usually see elevated blood pressures in pregnancy. Also potentially can impact some of your other organs in your body and cause some complications in the pregnancy. And so we do see preeclampsia or high blood pressure in pregnancy affecting women who get pregnant over the age of 35 at a higher rate than those who get pregnant younger. And so that's another thing to potentially keep in mind as a potential risk to the pregnancy. And the next thing I'll touch on are differences in how the baby grows. And so for women who get pregnant above the age of 35, particularly above the age of 40, we have found that there is a higher chance that babies can either be both big or smaller than we expect due to age. So that's another thing to keep in mind. And the last thing I wanted to touch on is also the risk of experiencing a later pregnancy loss. Now, this later pregnancy complication of having a pregnancy loss or a stillbirth is thankfully very, very, very rare, but we have seen an association with having a stillbirth and having a pregnancy at an older age. As I mentioned before, all of these risks actually occur on a continuum above the age of 35. So women between ages 35 to 39 have a relatively lower risk of experiencing some of these outcomes than, say, women age 45 to 49, for example. And so you really want to look at, the global picture of what's going on in the pregnancy in addition to just your age. With these things in mind, if you are pregnant and above the age of 35, I just wanted to leave you with 3 tips to keep in mind to help you navigate your pregnancy with peace of mind, knowing that you've sort of tackled everything that you could to make sure that both you and your baby stay safe. The first thing I'd recommend that you keep in mind is to talk with your provider about your genetic testing options. So as I mentioned before, given the higher chance of experiencing a genetic condition in your pregnancy above the age of 35, it's really important to just talk about what the genetic testing options are that you have available in the particular practice that you're following with. And there are a number of testing options that are both pretty accurate and very reliable, such as the cell-free DNA screening or the NIPT test. And there are also other advanced methods of testing the genes of the pregnancy that you can talk with your providers about as well. Then the next thing I'll touch on is whether or not you'll be eligible for taking a baby aspirin. Now, I encourage you to talk with your provider about whether you'll be eligible to take a baby aspirin. And the reason for this is, as I mentioned, women who get pregnant above the age of 35 are at a higher risk of experiencing preeclampsia or high blood pressures in pregnancy. And we've actually found that taking a baby aspirin starting roughly in the first trimester can actually lower your chances of developing preeclampsia by upwards of around 30% for some women. And so I think it's a really important thing to try not to miss and talk with your provider about to see if you would be eligible or it would be recommended for you to take a baby aspirin based on your specific health and medical conditions as well as your age. And the last thing that I'd recommend for you to talk with your doctor about is whether you'd be eligible for any additional monitoring in the 3rd trimester of pregnancy. So as I mentioned before, women who get pregnant above the age of 35 do have a higher chance of experiencing some problems with how baby grows, particularly for those who are above age 40, and also have a higher risk of experiencing a late pregnancy loss. And so you do want to talk with your provider to understand if you would benefit from any additional monitoring, such as any extra ultrasounds to monitor how the baby is growing, or any extra additional monitoring with something called non-stress test, which is essentially a monitoring of baby's well-being that you could be eligible for. Overall, having a pregnancy is an exciting journey. Having a pregnancy over 35 is a wonderful experience that can be filled with a lot of joy and excitement. And I've taken care of many women who have very healthy, enjoyable, and successful pregnancies above the age of 35 who didn't experience any of these complications. And so I just want you to feel encouraged and empowered with all the knowledge that you need to help you to navigate a pregnancy in a healthy and successful way. And so if you are pregnant and would like to find out more about what not to eat in pregnancy, go ahead and take a look at my checklist about 10 foods to avoid in pregnancy at badpregnancyfoods.com, or find the link below. And as always, if you've enjoyed this video, don't forget to hit that subscribe button and give us a thumbs up and share any comments below or questions that you have. I love hearing from you guys. All right, see you next time.